Hello friends, Assalamu alaikum. Today we will talk about the hemophilia, which is a bleeding disorder, and hemophilia is an inherited bleeding disorder due to the deficiency of certain plasma clotting factors. So some people have low or no production of factor 8, and some people have low or no production of factor 9. So hemophilia is an inherited bleeding disorder in which there is low or no production of factor 8 and factor 9. So these are the clotting factors. Factor 1 is called fibrinogen, factor 2 is called prothrombin, factor 3 is called thromboplastin, factor 4 is called calcium, factor 5 is called labile factor, factor 6 is missing, and factor 7 is called stable factor. Factor 8 is called the anti-hemophilic factor, and the factor 9 is called Christmas factor. Factor 10 is called Stuart power factor, and factor 11 is called plasma thromboplastin antecedent factor. Factor 12 is called the Hegman factor, and factor 13 is called fibrin stabilizing factor. So you can remember the name of these factors from this statement. Polish people try climbing long slopes after Christmas. Some people have fallen. So you can remember from this statement the name of the clotting factors. Actually, the most important is factor 8 and factor 9 in the case of hemophilia. Incidence of hemophilia. Incidence means the rate of occurrence. So actually it is commonly found in the males, but it is transmitted by the female carriers, and hereditary hemophilia is about 80% of all the cases of hemophilia, and hereditary hemophilia is linked with the sex chromosome. X chromosome, actually X chromosome is responsible for hemophilia, and about 20% of all the cases of the hemophilia is the acquired hemophilia, and acquired hemophilia is due to autoimmune disorder or maybe due to spontaneous gene mutation. So autoimmune disorder like rheumatoid arthritis or SLE, systemic lupus erythematosus, this condition may cause the hemophilia, and sometimes there is a spontaneous gene mutation, so that is also responsible for hemophilia. History of hemophilia. This disease is also called the royal disease because this disease affect the royal families of England, Germany, Russia, and Spain. The Queen Victoria of England is believed. Queen Victoria of England is believed to have been carrier of hemophilia B, in which there is the deficiency of factor 9. She also passed this hemophilia to 3 of her 9 children. Her son Leopold died due to the bleeding due to the hemorrhage when he was 30-year old, and he Paul, so due to the excessive bleeding he died. The daughters of Queen Victoria, Alice and Beatrice, also pass this hemophilia to their children, and then the hemophilia was carried through various royal family members for 3 generations, and after Victoria then the disease disappeared. So hemophilia inheritance. So how hemophilia is transferred from parent to offspring. So in the first case we have father which is non-hemophilic. He has normal X and Y chromosome, and here mother is a carrier for the hemophilia because she has one defective X chromosome. So what will happen when they both meet each other? So when they meet each other, their first son will be non-hemophilic because he will receive the Y chromosome from his father and the X healthy chromosome from his mother, so he will act as non-hemophilic. And in the case of daughter, she will receive the X defective chromosome from her mother and the healthy X chromosome from her father, so she will act as the carrier for hemophilia. And in the case of the son, he will be completely hemophilic because he will receive the Y chromosome from father and the X defective chromosome from her mother. And in the case of fourth daughter, she will be non-hemophilic, and she will also be non-carrier for the hemophilia because she will receive the X healthy chromosome from her mother and the one X chromosome from her father. So in the second case, the father is completely hemophilic because he has one defective X chromosome, and the mother is not a carrier of hemophilia. She is completely healthy. So what will happen when they meet each other? Their first son will be non-hemophilic because he will receive the Y chromosome from father and the healthy X chromosome from his mom, his mother. And in the case of daughter, she will receive the X defective chromosome from her father and the healthy X chromosome from her mother, so she will act as carrier for hemophilia. And in the case of the second son, he will be non-hemophilic because he will receive the Y chromosome from his father and the X healthy chromosome from his mom. And in the case of second daughter, she will be carrier for hemophilia because she will receive the defective X chromosome from the father and the healthy X chromosome from her mother, so she will act as carrier for hemophilia. And in the third case, the father is also hemophilic and the mother is carrier for hemophilia. So when they meet each other, their first son will be non-hemophilic because he will receive the Y healthy chromosome from his father and the X healthy chromosome from his mother, so he will be non-hemophilic. And in the case of daughter, she will receive the defective X chromosome from her father and the healthy X chromosome from her mother, so she will act as carrier for hemophilia. In the case of the second son, he will also be completely hemophilic because he will receive the defective X chromosome from mother and the healthy Y chromosome from father, so he will act as completely hemophilic. And in the case of second daughter, she will be also completely hemophilic because she will receive the defective X chromosome from her father and the defective X chromosome from her mother, so she will act as completely hemophilic because hemophilia is linked with sex chromosome, X chromosome. So classification of hemophilia, we have two classes of hemophilia. One is called hemophilia A, which is also called the classic hemophilia. In this type of hemophilia, there is low or no production of factor 8, and this hemophilia is accounts for 80 to 85% of all the cases of hemophilia. The second type is hemophilia B, which is also called the Christmas disease. In this disease, there is low or no production of factor 9, which is also called the plasma thromboplastin component. So about 15 to 20% of all cases, we have hemophilia B. So there are also some less common types of hemophilia. The first one is hemophilia C. In this type of hemophilia, there is low or no production of the factor 11, which is also called the plasma thromboplastin antecedent. We have another type is called Hagman's disease. In Hagman's disease, there is deficiency of factor 12. And we have another type which is called Owen-Willebrand disease. In this disease, there is the reduction of the Willebrand factors, and Willebrand factor is a protein that bind with the factor 8, and this protein prevent or protect the factor 8 from the rapid breakdown within the blood. Causes: so hemophilia is caused by the mutation or alteration in one of the genes, that genes which give instruction for making the clotting factors protein needed to form a blood clot. So hemophilia is caused due to the mutation or alteration in the genes that are responsible for giving instructions to make the clotting factors. So this change or mutation prevent the clotting factors from working properly, or sometimes there is no production of the clotting factors, and these genes are located on the X chromosome. So pathophysiology, we know that when there is injury occur to a blood vessel, so bleeding will start, and vessel will constrict, and clotting factors will be activated. You can see in this area the blood vessel is contracted, so to reduce the area of the wound. And in the normal case, when the clotting factors are activated, so factor 8 is also activated, and factor 8 cause a strong platelet plug to form over the wound area. After this, a stable fibrin clot will also form over the platelet plug, and it will act as a final seal over the injured area, and thus bleeding will stop. This is the normal case, but in the case of hemophilia A, we know that in hemophilia A there is no or low production of factor 8. So due to low or no production of factor 8, there will be weak platelet plug over the wound area, and after this there will be incomplete or delayed fibrin clot over the platelet plug, and thus bleeding will continue. So what are the clinical manifestation of the hemophilia? So there will be excessive bleeding from the cut or injured area. There will be also nasal bleeding, which is called epistaxis. There will be also large bruises under the skin, bluish coloration, and we will also observe blood in the urine and stool. There will be also swelling and painful joints, because in the joints there is the bleeding, and this bleeding then lead to swelling of the joints, and thus reduction in the movement of the joints. There will also be increased bleeding chances when there is any dental work. So this is called hemarthrosis, when there is bleeding inside the joints, and due to bleeding the joints will be painful, and the joints will also swell up, and movement will be reduced. We know that hemophilia is inherited disorder, so there is no completely cure of hemophilia, and we can avoid injury, and we can also avoid or reduce the intake of those drugs which cause the bleeding, like aspirin and indomethacin, and we can take good nutrition. We can also adopt good dental hygiene. We can also take IV administration of deficient clotting factors. And in the hemophilia there is intracranial hemorrhage. There is also prolonged nasal bleeding. There is also bruises under the skin, and there will be also warm, painful, swollen joints, and there will be reduction in the movement. And sometimes we will also observe GIT hemorrhage, gastrointestinal hemorrhage. So diagnostic evaluation, how we can diagnose or how we can evaluate the hemophilia. So from lab findings we can diagnose the hemophilia. In the blood test there will be low Hb level, because there is bleeding. So due to bleeding there will be low Hb level, but the platelets level will be normal, because this disease is not related with platelet. And bleeding time will be also normal. PT test will be normal. Prothrombin time will be normal, and prothrombin time is used to measure the clotting ability of factor 1, 2, 5, 7 and 10. And we know that none of these factors is involved in the hemophilia, so that's why PT time will be normal. APTT means the activated partial thromboplastin time. It will be more than the normal, and maybe 2 to 3 times more than the normal. So this test measure how long it takes for blood to clot, and it measure the clotting ability of factor 8, 9, 11 and 12. And we know that these factors are involved in the hemophilia, so that's why the APTT will be prolonged. The clotting time will be also prolonged. It will take more time to clot, and there will be low levels of factor 8 and factor 9. Factor 8 and factor 9 assay we also perform, and we can also do genetic analysis to evaluate the hemophilia. Management of hemophilia, we know that hemophilia is non-curable or non-treatable. So we can so we can just manage the hemophilia. We can just reduce the sign and symptoms. We can just reduce the severity of the hemophilia. So in the management first, we can replace the missing coagulating pictures. Like if someone has deficiency of picture 8, so we can administer him the cryoprecipitate. Actually it is a type of the plasma which is rich in the picture 8. And in the case if there is someone and he or she has deficiency of picture 9 and picture 11, so we can administer him the fresh frozen plasma. And if these both facility are not available, so we can also administer to that person the fresh whole blood. uh, in the case of mild and in the case of mild to moderate hemophilia, we can use the desmopressin, which release the factors 8 from the endothelial stores. In the management, we can also use the antifibrinolytics drugs. These are those drugs which is used to prevent the breakdown of the fibrin, and we know that fibrin are the mesh-like network formed over the wound area. So to prevent the bleeding, we have amino caproic acid and we have tranexamic acid, which is available on the brand name transamine, commonly used. For the pain, we use analgesic like paracetamol or other NSAID, but we should avoid aspirin and indomethacin. Also, we should avoid the beta-zolidine because these drugs induce bleeding. We can also perform the synovectomy to remove the damaged synovium. There are some complications related with the hemophilia. So first complication is the airway obstruction due to the bleeding into the neck and pharynx. There is also intracranial bleeding. We can also observe the intestinal obstruction, and there is also compartment syndrome. In the compartment syndrome, there is increased pressures inside the arm and the legs. We can also observe the degenerative joint diseases.